Thank you so much for joining us. I'm David Cochran. Rosie is away today. Well, this morning, countries around the world remain on high alert, waiting for more information about this new variant of concern. A reminder that 20 months in, the global pandemic isn't over. Borders that just recently reopened to international travelers are shutting down once again, including here in Canada, where travel restrictions have been imposed in the hopes of limiting the spread.
This is another reminder how serious the situation that we're in today and how cautious we all need to be. What we need to do is we need to do everything in our power to prevent it from entering our country and be ready for it if it does.
So how concerned should Canada and the world be? We're going to bring in Dr. Peter Singer, a special advisor to the Director General at the World Health Organization. Dr. Singer, thanks so much for joining me.
Thank you, David. It's good to be with you.
So I'm not sure if this is Omicron or Omicron, but I do know it's potentially trouble. What do we know about this new variant?
Well, the World Health Organization designated it a variant of concern 2 days ago, so we are concerned and named it Omicron. What we know is that it's got a lot of mutations and that it can change the epidemiology, the proportion of samples that are one variant or the other. What we don't know, David, is its effect on transmissibility, its effect on how severe the clinical disease is, and its effect on the effectiveness of vaccines. But obviously, we're working hard and as quickly as possible to figure those things out.
Okay, so those unknowns, those are the real big questions, right? Those are the ones that everybody wants answered. Do we have a sense of when we might get some clarity on those specific points?
Those points will come at different times, but days to weeks. You have to do the clinical studies and the laboratory studies to figure that out. And when it was designated a variant of concern, that a request went out to really researchers around the world in WHO's networks to be working clinically to sort out those issues. The answers will come, but of course we understand the uncertainty.
So the uncertainty has led to some panic around the world. We've seen stock markets really taking a hit. We've seen some borders closing. I just wonder, how worried are you and how worried should Canadians be about this?
Well, the World Health Organization designated it a variant of concern because we are concerned. It's the fifth variant of concern. And I think the key point is here, there are things that Canadians can do, individual Canadians. For example, if you're not vaccinated, please get vaccinated because that makes things much safer for you. And of course, use the public health measures. Outdoors is safer than indoors, be in well-ventilated places, wear a mask, use physical distancing. This is a call for individuals to raise their guard. There are things that individuals can do which help with any variant or any version of this virus, including Omicron.
Right. I mean, the virus may change, but the public health messaging remains largely the same. I mean, the best ways of dealing with it are still the best ways. But, since this has become this urgent issue and designated a variant of concern, we've seen it pop up in the United Kingdom. We've seen 13 cases in the Netherlands today. How likely is it that this may already be in Canada at this point?
It is, it is very possible that it's in any country, and the harder one looks, the more likely one is to find. So wouldn't be a surprise. There's another thing though that needs to be done here, as you say, as this virus spreads, which is to vaccinate the world. And I don't know how plainly I can say this. Of course, this is an act of justice, but principally, it's an act of protecting Canadians. To say it very plainly, one of the most important things that Canada or any country can do is vaccinate the world, because that is the way to stop the virus from spreading, to tamp down the risk of variants. I mean, we want to close the stable door before the horse bolts. And the way to do that is to vaccinate the world. Yes, it's about justice, but it's also, and this is, I think, the key point, one of the most important things that can be done to protect Canadians is to vaccinate the world.
Yeah, it's an act of self-defense. I think Canada has committed to about 200 million doses through COVAX and other measures, but only a few million of those have been delivered. So it's been a challenge. But and in response to this immediate variant of concern, Canada's imposed new travel restrictions from the 7 countries in southern Africa. I know the World Health Organization has been critical of travel bans in the past. I mean, what do you make of that kind of response from Canada and other countries around the world?
You know, the rules of the road on travel restrictions have been set by governments themselves. And so it's the responsibility of governments to make that call. What the World Health Organization says is that those travel restrictions should be risk-based and time limited. And keep a couple of things in mind. One is they're definitely not a silver bullet. They need to be part of a comprehensive package. And secondly, you want to incentivize people to be transparent. You want to incentivize countries to be transparent. You want to give them positive incentives, and that's a really, really important piece of the really important piece of the puzzle.
Yeah, and I know South Africa has certainly complained about this, that they've done a very good job of surveilling this, finding this, alerting the world to it, and they feel like they've been punished as a result of this. But I just want to circle back to the issue of vaccinating the world and vaccine equity. And just South Africa has enough vaccines. They just have a slow uptake and a high hesitancy rate. The other countries in Southern Africa is a different picture. So how much has vaccine equity played in this situation with the emergence of this new variant?
Hugely. I mean, an ounce of prevention is worth a pound of cure. And, you know, yes, it's true that South Africa might have paused vaccination this week. But if you look at the last few weeks, if you look at the last few months, the problem has been supply in South Africa. And that is the time frame also when the variant arose. You know, the vaccination rate in South Africa is about 24% fully vaccinated. Would we be happy with that rate? Across Africa, it's 7% as a whole. 1 in 4 health workers are vaccinated. About 550 million vaccine doses are needed to be donated to get to the 40% of every country vaccinated target that we've called for by the end of the year. The way to make Canadians safe is to vaccinate the world, because what viruses do is they mutate. And if they are raging anywhere and they rage in unvaccinated populations, then they will mutate more and variants will arise. I mean, David, wouldn't people rather prevent the next Omicron from arising than scramble like we're doing now after it arises? That's what vaccinating the world is about. This is a wake-up call to vaccinate the world. And frankly, we've had a lot of wake-up calls, and we should stop sleeping through the alarm.
Okay, Dr. Peter Singer, that's a stark message to end it on there. Thank you so much for your time.
Thank you. Thank you, David. Good to be with you.
Good to be with you too, sir. Thank you.